Hi, my name is Dr. Steve Swanson. I'm a pediatrician and a pediatric infectious disease doctor, and I've been in Tanzania now for 13 years. Um, I did not expect that my career in Tanzania was going to take a turn towards neonatology, but it has, and it's been one of the best experiences of my life. We're in our 12th year now of running the neonatal intensive care unit, or a NICU, in Tanzania at Arusha Lutheran Medical Centre. And over the years, we've been running our NICU. What we've seen is babies that before would not survive, today survive, and they survive at very high percentages with very good neurodevelopmental outcomes. Under phototherapy lights is a baby that's 586 grams, which would probably be barely over 1 pound, born at 24 weeks gestation, so 4 months early, normal pregnancies being 40 weeks. In Tanzania, a 24-week baby boy or baby girl, 24 weeks gestation, would be considered a stillbirth, and they would have a survival rate that's well under 1 per 10 or 20,000. But in our NICU, a baby this small probably has about a 50-60% survival. So instead of 1 in 10,000 surviving, it might be 1 out of 2 surviving. And this little one is doing very, very well and is several days old. We do everything low tech. The highest tech that we might add is an incubator. And an incubator would be used only in circumstances where the baby is so small or so unstable that we can't do skin-to-skin kangaroo mother care or kangaroo father care. So without mechanical ventilators, without expensive equipment, using a low-cost, low-tech approach, our NICU survival rate is over 90%. And our babies that are born under 1,000 grams or 2.2 pounds, their survival rate is around 75 to 80%. How does that compare to other places in Africa? Survival rates would be single digit in most hospitals as opposed to 75-80%. Some of our babies are premature. That might be roughly half to 2/3 of our babies. And then some of our babies are bigger and term babies who come in for problems of difficulty breathing, jaundice, feeding problems, surgical problems, or infection. And what I love about the NICU is primarily that we are showing the country that low-cost, low-tech approaches can change the narrative, and that babies who are previously determined to be unable to live can actually survive. And the reason they survive is not because of the equipment, but because of the nurses and doctors in Tanzania who are skilled and motivated and pay attention to detail. And it's the team that we've developed of doctors and nurses and the culture that they have of being proactive and anticipatory and working hard that has allowed our NICU to succeed. Today we're gathering national and international attention. We are running the largest neonatology training conferences in the continent. We wrote a book on neonatology, and this book, called Every Breath Counts, Manual of Neonatal Care and Drug Doses, is now into the 3rd edition, and it's being used in over 200 hospitals across Africa, as well as hospitals in Asia. And through the book, through our nurses, through our conferences, what we're trying to do is send out a message to other hospitals throughout Africa and even in Asia that newborn survival is possible, and it begins with training the team, and it begins with changing the culture of a NICU nursing and doctor team, through involving the parents, elevating and investing in our nurses, and bringing our doctors into a place where they're safe and they feel like they can learn and they can work with the nurses. This produces a family-centered team approach to babies, and that is why our babies are doing so well in Tanzania. So the emphasis should not be on the missionary doctor, it should be on the nurses and doctors who have made this all possible. And so I have to quick bring my team in. Come on, guys, because this is not. So I have Dr. Eunice. She's the brains and the force behind the NICU. I have Dr. Esperanza, who is an amazing doctor, and she's working in our NICU. And I have one of my NICU nurses here, Napir. And Napir has been working with me for almost 9 years now. These are 3 of about 25 or so doctors and nurses that are part of our NICU team. So if we're successful, it's because of you.